great pleasure to welcome Sean Murray from the AMDF. Sean was really instrumental in bringing everyone together today, so I'm really looking forward to hearing some of the work the AMDF do and the real impact that they have from the patient's perspective. Thanks, Sean.
I might use that because Thanks very much, John, and good afternoon, everyone. Thanks for having me here today. Can everyone hear me okay? We good? Thanks. We've got sort of a dual hat to wear today. We want to talk about, I'd like to present and try and share, I guess, the patient's perspective around mitochondrial disease. While I'm from the AMDF, I do have a personal family connection with mitochondrial disease as well, so I do get to talk from first-hand experience, but I'm also going to share some information from a presentation that was given by my sister in the Sydney Symposium here just two days ago. So I guess that'll become a bit clearer as I go through there. So to those who were there at the presentation on Tuesday, you're possibly going to see some of the same information, and you're my test as to whether I'm representing my sister, and you're not allowed to tell her if I make stuff up. So thanks for having me. I guess firstly in relation to the foundation, Mitochondrial Disease Foundation exists to further the cause and to around mitochondrial disease, to drive funding into research into mitochondrial disease and to provide support to patients and their families until that time that significant cure or significant treatments are found. And so we're thrilled to be playing that role, and we've been in existence for coming up for about 7 years now, and we're pretty humbled by, I guess, the number of good people who are very dedicated and actively working in this field, and many of you are here today, so thank you so much for your efforts, and please maintain the rage. One of our roles is to present the patient community, and what's apparent to us the more that we learn about the patients is that every patient's story is different. And we've heard about the hundreds of different potential genetic causes of mitochondrial disease, that one type of genetic problem can cause many different symptoms, and one type of symptom can be caused by different genetic causes. So there's this in my IT hat, many-to-many relationship between genotype and phenotype, and I think that what becomes, we see that, and we unfortunately we see news stories about this pretty much every day at the foundation, and more often than not, the people we hear from, many of them really have heartbreaking stories, and particularly when we're looking at young children who are mortally affected by this disease, and that's all too apparent. So it gives us a motivation, and it keeps us really focused on our work. So my personal connection here with mitochondrial disease is, and I've lost my slides here. No, it's okay, I can read that. And I know the story anyway, so it's okay. Is that we've known in my family, in my immediate family, we now know that we've been affected by mitochondrial disease, and particularly by MELAS, caused by one of the more common single-point mitochondrial DNA mutations for at least 3 generations that we know of, including my generation, my mother's generation, and my grandmother's generation. We suspect that anecdotally, when we look back at longer-term history, what we know in my family, there's stories about what might look like it's gone a bit further, but they were the olden days, right? And people died young. But this is my grandmother on your right. Her name's Dorothy. This is her sister, my auntie Agnes. This is back at my grandmother's wedding day there. My grandmother, Dorothy, was... I don't remember her being well. I certainly remember her, but from my point of view, she was always sick. She was reportedly an extremely stylish and sophisticated woman in her 40s and 50s, but then by the time I certainly knew her, she was a sick woman in her 60s, and she suffered from what were thought to be strokes. She was severely deaf. She was... her balance was significantly affected. It became apparent as I grew a bit older that she was suffering from some intellectual issues and that appeared to degrade over time. And she passed away in her late 60s after spending a lot of time in hospital for different points, and just seemed to progressively get worse over time. But so died from some sort of mysterious neurological type of disease. This is my mum Lorraine, and we first noticed symptoms with Mum in about her 40s. She suffered what initially appeared to be some pretty significant hearing loss, and she was a very slight woman. My mum, I'm not that short. My mum was 5 foot tall, so at about the age of 3, I was taller than my mum. And she probably weighed, 40-something kilograms, and not very exercise tolerant, not the kind of sporty kind of person. And but none of that's weird. It's your mum, right? It's just what it is. But so we noticed Mum suffered, much like Nana, rapid hearing loss. Her balance started to go. She used to drive us, and it was pretty scary. So I got my license as soon as I could, and then I drove Mum. And so she, over the years, then she just seemed to slowly deteriorate. And so I guess at this point we knew that there was this. Oh, sorry. And then back to the earlier slide. My auntie Agnes, my grandmother's sister, same symptoms, deaf as an absolute brick lump of wood. She couldn't hear a thing, but didn't necessarily have the neurological type of symptoms that my grandmother had. But and then her daughter, my mum's cousin, it's all women, deaf as a doornail as well, from her 40s. So sort of this classic just seems to be maybe a well-behaved form of mitochondrial disease, David, with the 40-year-old hearing loss. And so we always knew there's something going on in our family. We didn't know what it was. And then this is my brother, my older brother Peter. He is older than me. This was not a recent photo. This is from his wedding. But at about the age of 34, so I was 25 at the time, and I'd returned from my honeymoon. So I was a child bride, obviously, been married for a long time. Returned from my honeymoon, and Peter's in hospital, and he'd suffered from a stroke, or what was thought to be a stroke, which was bizarre. Peter was healthy. Peter was the sporty one in the family. My big brother, obviously, who played touch footy with me and managed to tackle me a lot during touch footy, who would bowl me out in cricket, who would bat to me left-handed. He was right-handed, and I could never get him out. Big brother type stuff. Fit, healthy guy. So he's in hospital and he's had a stroke. So he ended up in a place I guess in hindsight was in the right place. He turned up to a hospital and they did some MRIs and they showed some of the imaging, and it suggested that this wasn't a traditional stroke. It wasn't a bleed or a blood restriction there. And somebody knew something about this. They looked at the family history and started to look at my mum and my grandmother, and they started to think, well, this was probably something called mitochondrial disease. And that's the first time in my family that we'd heard this term. And so Peter was tested, and he was shown to have that mitochondrial DNA mutation that was known to cause the disease. And then, so this is my brother and my mother. Then my mother was tested, and then my siblings and I were also tested. So I have 3 sisters, and that's just gone. No, 3 sisters, and I'm the youngest. And so we were all tested and shown to carry this point mutation in our mitochondrial DNA. So finally we have an answer to this mystery health problem that's been hanging over my family for generations. Wonderful stuff. But I guess that's probably where the story really began for us. And now that we know about this is where things really ramped up. So for Peter, following his first acute episode, his health slowly deteriorated, and he suffered more of these mitochondrial strokes. He suffered from seizures, he suffered from hearing loss, he suffered from balance loss, he lost a lot of weight. He seemed to suffer from some cognitive type of impairment. He couldn't drive because of his health. He lost his job because of his health. And all of these things made him more and more socially isolated. I remember going out with Pete when I was, 18, 20 years old, your big brother, and in my mid-20s and a bit older, as Peter's health deteriorated. And, the bouncers at a pub would say to Pete, you can't come in, you've been drinking, and, or you're a drug addict. I remember people looking at Pete and thinking you're a drug addict because he has these symptoms of emaciation, and etc. And that was hard. That wasn't very nice at all. So Peter suffered from throat cancer, or tonsil cancer, sorry, and he just seemed to have testicular cancer. He seemed to suffer from kind of everything you could. He was a ludicrously unlucky man. And it was at a routine checkup where one of his specialists detected what I guess we now know was maybe a precursor to another acute episode of a mitochondrial episode. So he was admitted to hospital, and this was a really confusing time. There were the specialists coming and going, and Peter then went into ICU, and it was within about 2 weeks that he passed away. That was tough, obviously. And what was particularly tough is Peter is a fairly 45-year-old man, so about 11 years from his first stroke to when he passed away. He had a 13-year-old son, my nephew Isaac, and an 11-year-old daughter, my niece Isabella, and they were with him when he passed away. And I speak to them, and unfortunately, my niece doesn't remember Peter being well. My nephew has some memories, but not many. They're now 19 and 17, but so that was pretty horrible. I guess then that brings us to my generation, to my sisters and myself. Now, what I'll share now is something that my sister Rhonda here. So this is my sister Rhonda in the middle, and her daughters, my nieces Annie on your left and Cassie on your right. Rhonda shared some of this information from first hand, so I'm speaking second hand, and I don't mean to do her a disservice, but some of it was it was the first time I'd heard some of this as well. So Rhonda's a student. She's studying a fine arts degree, and I think going back and trying to sort of nurture her soul a little bit, as she's much older than me, so we give her heaps about that. She's nearly 50, so she's a very mature age student, we might say. But she worries. She's really worried about her health. She's suffered from rapid hearing loss probably in about the past 3 years. She wears 2 hearing aids. It's getting more and more difficult to communicate with Rhonda. She misses a lot on the phone. She misses a lot in person. She's tired all the time. She's fatigued, and she has bad days and good days. And her bad days can be needing to stay in bed for all day. She has headaches and migraines that can last for several days and really knock her about. And one of the things that she said when she presented the other days was that in university holidays she tries to catch up with sleep, so she has a daytime nap. And I think Rhonda alluded to the fact that her daytime naps have sort of stretched from a nap to 2 hours to 3 hours to 4 hours a day. And then she has no problem sleeping in the night time. So Rhonda's worried about her health, and we're all worried about Rhonda's health. What's going to happen to Rhonda? We've seen this story before, so it's pretty concerning. And she says that life is a bit of a struggle, and she's a very social person. She loves a good party. We are already booked in December for her 50th birthday party, so she's well organised as well. But she finds herself withdrawing because it's all getting a bit too hard with her hearing loss and her lack of energy, and that's tough to see for Rhonda. However, she has an inner resolve, and as she said, she has an inner determination not to let this disease get the better of her. But she also says that's easy to say now while she has her health. So Rhonda also worries for her daughters, Annie and Cassie. Annie's 17, Annie's 16. Sorry, she wonders what the future will hold for them, and she worries that she'll pass this disease on to them, or maybe to their children. She certainly hopes she won't pass that disease on. And I think around now, and over the past couple of years in particular, Rhonda talked about a sense of there being that this big black cloud, as she calls it, that's hanging over our family is starting to dissipate. Perhaps there's some signs and there's some hope out there. That and she says that it's like a big ray of sunlight's finally shining through. And she says, I'm quoting her here, "I can't begin to tell you how wonderful it is to hear about mitochondrial donation, that she sees it as a big positive step which gives sufferers hope, and hope is something that she says we haven't had before, and that's certainly consistent with what we hear from the Foundation's perspective and from other patients." Rhonda has said that she would have used this technology had it been available to her when she was having her children. She would have used mitochondrial donation. And for her daughters, Annie and Cassie, if and when they look to have a family of their own, she said that she would strongly be encouraging them to consider the viability of that and what that might mean for them. And it's something that she would encourage them to consider. So Rhonda said that, and I would agree that I think from, for future generations in our family on the maternal side, that mitochondrial donation really gives us a real glimmer of hope and a chance to prevent this disease being passed on, because we've seen how horrible it can be, and we certainly wouldn't want that for anybody else in our family. And Rhonda said it means that big black bloody cloud will stop following us and hanging over our heads. And Rhonda had nothing to do with naming of the bloody long walk either. But putting back my AMDF hat on now, I guess, I've obviously got a deep personal motivation for our cause here with the foundation, and whatever that is, and however many different types of possibilities or treatments and cures that have to come out with these mitochondrial diseases, me and all of us involved in the foundation, be it with a personal connection to the disease, with a professional connection to the disease, or just a genuine interest, we're deeply motivated to make that difference and to do everything we can to give hope to the patient community. And again, I know that there are many of you researchers in the audience and many of you in professional fields that work with mitochondrial disease patients. And on behalf of us all, I would implore you to maintain the rage and keep up the fantastic work. And we're all counting on you. So thank you very much for your time today. I hope that's shared a little insight.
So I'd like to really thank Sean for sharing that story with us. I'm sure this was it's obviously been a really difficult journey for the family, and I really wasn't aware we were going to hear the personal story today. So I'd like to thank him very much for doing that. Obviously, a very brave story, and I think a real insight into what patients and what families experience with this. If anyone's got any questions, welcome to ask Sean now, or we can wait until after there's one over here. Yeah.
Sean, thank you for that deeply moving personal story. Have you any idea why your grandmother might have had mitochondrial disorder? Was there any consanguinity or anything like that? Or anything you could put a finger on?
Well, I'm certainly not aware of any consanguinity, and I don't know that it's relevant because the genetic change in my family is on the mitochondrial DNA. So you're looking at that would have come directly from her mother, and there are geneticists here who can speak to that with much more command than I can. But we certainly know that her mother died in her 30s at a very young age. But this is the 18-somethings. So certainly not aware of that as to the why. No, I can't answer that.
All right, I think we'll move on. Thanks very much. Thanks again, Sean. That's great.